I completed a sports medicine fellowship in orthopedic surgery, so my area of expertise is minimally invasive surgery, including arthroscopy of the knee, shoulder, hip, ankle, and elbow. So I do a lot of sports injuries, ligament reconstructions, ligament repairs, tendon repairs. Having grown up playing sports my whole life, I was always intrigued to be part of a team and part of an organization. And so sports medicine drew my interest early on because I always enjoyed helping out the athletes and being a part of the team and getting these athletes back onto the field and maximizing their level of play and maximizing their competition. With a lot of the injuries that I see, surgery is an option, but a lot of times we can treat things without surgery, whether it's with activity modification, physical therapy, anti-inflammatory medications, or occasionally even an injection to help get them back to their prior level of activities. One of my areas of expertise is in hip arthroscopy. This is a minimally invasive surgery performed in the hip joint to either remove loose bodies, clean up loose cartilage, and sometimes we are removing impingement or repairing labral tears that is affecting the patient's hip and their ability to participate in activities. It is a successful surgery that a lot of times gets these athletes back onto the court and back onto the field and back to doing the things they love.